Several advances have been made in the definition, staging, treatment, and response assessment in multiple myeloma.
One must consider the age and vitality of the patient when approaching these new advanced treatment options. For older, unfit adults with multiple myeloma, diagnostic, prognostic, and treatment options vary due to patient-related factors like frailty and high-risk genetics. In this time of rapid advances, here's what this expert recommends you consider.
Assessing frailty in an older adult is time well spent. We often hear that performing geriatric assessments is too time consuming in the busy modern clinic, but it is value added that if we can appropriately assess these patients, direct treatment, modify treatment to that older adult's unique health, that we will ultimately hopefully improve their care.
For the young, fit, multiple myeloma patient, there are several treatment options, including induction therapy, stem cell transplantation consolidation therapy, and maintenance therapy. The resulting outcomes of each therapy vary, as does the discussion about the sequencing of the suite of therapies for relapsing disease.
Fortunately, in multiple myeloma, we have a plethora of options and many therapies to choose from. The question is how to choose among those therapies in real time today, and what is most practical and what is most effective.
MDS and AML Matter is an education program designed to improve the diagnosis and treatment of myelodysplastic syndromes and acute myeloid leukemia. This special session was conducted in the style of a tumor board with the goal of providing guidance to the interdisciplinary MDS AML care team on patient evaluation, prognosis, treatment, and management of complications.
We're very excited, as I mentioned, about combining novel therapies. One approach is combining two of the newly approved agents. We're pretty excited about a combination study combining gilteritinib and venetoclax in adults with FLT3 mutated leukemia. Likewise, there is anticipated a large clinical trial in adults with newly diagnosed FLT3 mutated disease, comparing the now standard of care of 7 and 3 with midostaurin versus 7 and 3 in gilteritinib. And there are a number of studies looking at the addition of venetoclax, IDH inhibitors, and combination therapies with other agents.
MPN Heroes are committed to making a difference in the lives of people living with myeloproliferative neoplasms, MPNs. Their understanding, compassion, and support bring strength to the MPN community. Insight sponsors the MPN Heroes Recognition Program and proudly celebrates their remarkable efforts. Congratulations to the 2018 MPN Heroes. Learn more about the 2018 MPN Heroes and the MPN Heroes Recognition Program. Visit mpnheroes.com.
CLL is one of the most dynamic fields of clinical research, and the architecture of the translational research meant to control the disease was the topic of the Wasserman Lecture. Several newly approved agents are poised to dramatically change the management of CLL and have already started to improve clinical outcomes for patients. Dr. Michael Halleck says that with the insights into the basic biology of this leukemia, we can now implement them into modern therapies that are very successful in prolonging the life of patients.
All instances, you combine 2 or 3 principles to achieve best responses, and they all contain biological agents. And then the outcome is usually a long control of the disease. Whether we achieve cure already can only be said when we observe the patients longer, but it seems like we are curing patients more and more now.
Following the lecture, 2018 ASH President Dr. Alexis Thompson delivered a State of the Society address highlighting current ASH initiatives and the work conducted year-round. We'll be featuring many of those initiatives right here on ASH News TV.